identify diseases by observing the droppings of your birds. It's important to know this because most poultry farmers in Nigeria operate on a small scale. We don't have the equipment in our farms to give proper diagnosis of diseases on the farm. So it's important that we know how to guess on what could likely be the problem of our birds when we look at their physics. Okay, so this is what we want to consider today.
So the first thing we want to talk about is the normal droppings. It's important to know how a normal physics looks like so that you won't overreact when you see color changes in the physics. So how does a normal droppings look like? Actually, they vary depending on the feed, the temperature, or perhaps the infection that is involved. Okay, so the normal droppings are fairly solid, slightly soft brown with stains of white. The solid part is the feces, while the white part is the uric acid. That is what is urine in other animals. Okay, secondly, if you notice that the feces is greenish, there are so many things that could be wrong or so many things we should suspect. First, if you don't see any other symptoms, it's possible nothing is wrong with your birds. Perhaps your birds only fed on green vegetables. But in the case where you notice that your bird has paralysis, especially the paralysis of the leg, you see the legs becoming weakened and becoming paralyzed. You see loss of appetite, and sometimes the bird even die without signs. It could mean that they are actually infected with Marex. Okay, Marex disease. Okay, so if you notice that the bird sneeze, the show sign, you feel the temperature rising, fever, and then shortness of breath, it could mean that the birds have avian flu. So, and if you, in addition to that greenish stool, if you notice that they are just simply losing weight, they look as if they are active but they are losing weight, it could be a sign of internal worms. Okay, and then if you see okay paralysis, the kind in which the bird stretches the legs and turns the neck, you know that is actually Newcastle disease. So how do you treat against Newcastle? As for Newcastle, you just keep giving them antiviral drugs and trust God to help some to recover, although you may record mortality. Okay, for the Marex, you won't actually see a particular drugs that can cure it. So the best way to treat against Marex, or to handle Marex, is to vaccinate against Marex on the first day. That is why it's important you get your birds from good hatcheries, those hatcheries that vaccinate against Marex. And then we have the avian flu. If you notice avian flu, then you have to just administer antiviral drugs and trust God that some will bounce back. Okay, and then in the case of internal worms, you administer ivermectin. So these are actually the ways to handle issues with greenish stool. The third one we want to consider is the yellowish dropping. If you notice that the droppings are turning yellow, okay, if there are no other signs aside that yellowish droppings, it could just mean that your birds might have eaten uh, corn or food that is, or too much of soya beans, or some of those things can make it looks as if it is yellow. Okay, so this is just reactions to what they eat. But if in addition to being yellow you notice it is foamy, that could be an early sign of coccidiosis. If you also notice diarrhea, the stuff is the you see the chicken struggling to poop, you know that there might be diarrhea somewhere. Okay, you notice that the birds reduce their intake of food and then they are not growing fast. It could mean that uh, this yellowish dropping is a sign of fowl typhoid. Okay, it can be a sign of fowl typhoid. Typhoid, two droppings are involved in typhoid. That is the yellowish droppings and the white droppings. Okay, with less activity, it could also mean that it's another sign of internal worms. Okay, so how do you treat if you notice early sign of coccidiosis? You can give them embazine forts, amprolium, coccistop, triple sulfur, and those ones who are good in organic medications. Many persons recommend bitter leaf. Okay, so we have okay, for the treatment of fowl typhoid, you use either doxynio or neomycin. Those two antibiotics are actually effective against fowl typhoid. Okay, and after treating fowl typhoid, it's important you isolate your birds because even birds that seems to have recovered are carriers of salmonella, which is the pathogen that causes fowl typhoid. So the fourth one is black droppings. If you notice the poop is black, some most times it's actually what they feed on that changes the color to black. It could be that they fed on charcoal, which is good for them because it has a way of fighting toxins in their system. Okay, and that is why local fowl that go about grazing and picking ash near the kitchen, especially those that stays in the village, it's part of the reason why they are very healthy. Those charcoal has a way of reducing toxins in their system, and sometimes the black droppings can be a sign that you are feeding the birds with too much of proteins. Okay, so but if you notice the okay, so if you notice brown droppings, it especially with other symptoms like ruffled feathers, it could mean that your birds have E. coli. E. coli, especially if it's also accompanied with difficulty in breathing and loss of appetite. Okay, so we suspect E. coli, or if you notice acute respiratory disease, we know this is quite different from the chronic respiratory disease. Is actually a sign of infectious bronchitis. Okay, so how do you treat against E. coli? You can use triple sulfur, you can use gentamicin, you can use doxynio. Those ones are actually very effective. Okay, gentilo is also a very good antibiotics. Then we have the infectious bronchitis. You can use doxygen 20 to fight that. Sometimes, even without giving them antibiotics, some birds may recover from infectious bronchitis all by themselves. Okay, so the next one is the watery dropping. As for the watery dropping, if you don't see any other sign or symptoms, it could mean that the birds are stressed and perhaps may have taken too much water. Okay, so if you don't see any other symptoms, it could mean that that is what is actually making them to have watery droppings. Okay, but if you see other signs of respiratory problems, yes, you know that you should be suspecting infectious bronchitis also. And sometimes fowl typhoid can come in that form. Like I explained, you can use the antibiotics that is prescribed for infectious bronchitis to handle the situation. Okay, we have the red droppings. As for the red droppings, if you notice just little stains of red on the feces, you may not need to worry that much. Uh, that one may not actually caused by coccidiosis, but if the droppings are obviously red, then it's important to quickly treat against coccidiosis, and coccidiosis is one of the major challenge we have with poultry business. So you don't actually overlook when you notice the droppings are red. You quickly administer anticoccidiosis, okay, so that they can recover. I mentioned it earlier on, Amprolium, Coxystop, and so many others, Embazine Fort. Okay, you can use any of them to handle the situation. And since there are many strains of coccidiosis, if you are using one drug and it seems not to be working, wisdom demands you change it to another anticoccidial drugs. Okay, so that is how to handle the situation. So the next one is the smelly poop. If you notice that the droppings is bringing out offensive smell, and then you observe your birds and notice that the face is getting swollen, then you have to handle infectious coryza. Okay, so you can try the tetracycline drugs on them, or any oxytetracycline drugs. Okay, and if that one doesn't go down well, because sometimes coryza can resist tetracycline, you can use triple sulfur to handle the situation.
One very important skill every successful poultry farmer should have is ability to observe, the ability to observe your birds, the ability to tell the difference between a sick bird and a healthy bird. So how will you know if a bird is sick if you don't know how healthy birds look like? So when you enter your pen in the morning, the first thing to do is not to feed them. The first thing to do is to observe them. Check if they are active, check if they have good appetite, and check if their droppings does not have offensive smell. So if their droppings have offensive smell, you know something is wrong somewhere.